Hi, and thank you everyone for joining MassSupport's roundtable on the impacts of COVID-19 on the work of peer specialists. MassSupport is a free, confidential, and anonymous resource for folks living throughout the Commonwealth in response to the pandemic. We're funded through FEMA, and we're a crisis counseling program or CCP. My name is Brandman. My pronouns are she, her, and I'd like to invite Vesper Moore to give a land acknowledgement before we get started.
Hi, I'm Vesper Moore. I use they and Aya pronouns. I'm coming from the Kiva centers, and I'm just going to start with a brief land acknowledgement. I would like to acknowledge that the land upon which we gather is the seized and occupied territory of the Nipmuc people, particularly of ancestral ties. I want to preface that the land does not belong to anyone, but rather that it is inherent in its nature. And that also we want to recognize the tribes that have not been federally or state recognized and their ancestral ties to these grounds. Thank you.
Thank you, Vesper. So as I said, my name is Brandman. I did mention I'm with MassSupport. I'm a certified peer specialist working with MassSupport. I think that's it for my intros. And I'd like to invite everybody to introduce themselves. If you could just mention your name, your pronouns, a little bit about your role at your program or organization, and mention, if you could, something that you're proud to be part of through this work. So folks have maybe a little more concrete understanding of what this work can look like. If we could start with Vesper.
Of course, Vesper Moore, they and Aya pronouns from the Kiva centers. I work as a chief operating officer. I oversee a lot of like our operations and things that we do day to day in the community and in different spaces. The Kiva Centers is a peer-run organization here in Massachusetts. We do a lot of like direct support with people in the community. We have a peer-run respite. We have a recovery learning community. We offer certified peer specialist training, and we have a young adult access center. It's a little bit on Kiva. Kiva means to go inside of yourself and come out healing yourself. It is a Hopi Zuni concept.
Yeah, Shulamith, if you could go ahead.
Of course. So I'm Shulamith Jacobi. I also work at the Kiva centers. My role is the community bridger and equity advisor. So with the community bridging aspect, I go into hospitals and support people who are currently held there and do advocacy and just human connection. And then once that person leaves the hospital, they have someone in the community that they know and they trust and they have a relationship with. And then the equity advising components involve making sure that our Kiva centers is accessible, and we're looking into different identities and how we can be more responsive to that. So I'll pass it on.
Thanks. Sera, we could hear from you.
So my name is Sera Davidow. I use she, her pronouns, and I'm a part of the Wildflower Alliance, formerly known as the Western Mass Recovery Learning Community. And the Wildflower Alliance, and my role there is, it's changed over the years. I've always been a part of the leadership team, but what that's looked like has changed. Sometimes it's meant having my hands much more in direct support and working in hospitals and in our centers, but now it's more in the training and learning and educational opportunities piece and grant writing and all that. But we, as a general community, we have 4 parts. We have the peer-to-peer support piece that has our peer respite, our work going into hospitals and jails, our 4 community centers, our Hearing Voices, Alternatives to Suicide groups, all of that. And then we have an advocacy piece, which now has a statewide and sometimes beyond state focus of really looking at marginalized voices, how to support people, voices to get heard, how to make sure people know their rights and that they have the right to ask questions and say no and all that. So there's so much to be said about that, but I don't want to take too much space. And then we have an alternative healing practices piece that is about making sure people have real choices to access other options than what is conventionally offered by clinical systems in the state. And then our learning and educational opportunities piece, which is we do a ton of training in this country, in this state, on anti-oppression, on hearing voices, alternatives to suicide, trauma, so many other pieces. Also excited to do that, some of that in other countries as well, and bring some of our work there. And we have some books out on peer respite and films, and have a film with hopefully coming out very soon. So I'll leave it at that.
Thank you. Riley?
My name is Riley. I use he, him pronouns. And I'm an advocate with the Wildflower Alliance. I have a few different roles, but I guess what I'll be speaking to today is my role as an advocate at Afiya Peer Respite. And basically, what I do here is I'm trying to help create a place where people can feel supported, to experience like the full complexity and intensity of their lives without the threat of losing their basic human rights. So we're just trying to create a alternative to psych units in hospitals and clinical respites. Yeah.
And a little bit, if you could, about something you're proud to be part of, or have, that you were proud to have been part of. Something particular can be through your work at Wildflower Alliance or other previous work.
I guess I feel proud to have been a part of like the work of trying to keep our supports available to people through the pandemic. And I also feel like just having had access to the community centers, the support groups, Afiya, that those have been like a real source of support for me too, to like respond to this last year and a half of pretty radical change. Yeah.
Thank you. So we were hoping to have another panelist, but she won't be joining us today. So we have Michael from Riverside Community Care. And I should clarify, Michael is not substituting. Michael is one of our planned panelists, but we were supposed to have another person.
Thank you. My name is Michael Chesnulavich. Like Barrett said, I work for Riverside Community Care in the Milford office with the ACCS program. I am a certified he, him pronouns.
Sorry, if you could clarify ACCS for folks.
Sure. ACCS is Adult Community Clinical Services. We provide basically one-on-one support to folks in the community. I'm a certified peer specialist and a supervisor. So I work with individuals one-on-one in the community or in their homes. And I also supervise a couple of peer specialists and a recovery coach on our staff. And I'm really proud of, I'm proud of the fact that I've been able to build and maintain relationships with the folks that I work with, the people in our services over the last 3 years that I've worked for Riverside. It's really an honor, and it's something that that means a lot to me.
Thank you. Thank you everyone for joining us. So we have some questions around how your work has been adapted during the pandemic. So we have two folks we have a couple of panelists for 2 of our 3 organizations, and I would invite you to, if you would like to, defer to your partner from your organization if you feel they would be better better able to answer the question. You don't have to both answer if you don't feel the need to. But so first question, and I think we'll go around in the same order with Vesper, Shulamith, Sera, Riley, and Michael. So the first question is, how have the challenges of COVID-19 impacted the mental health of the communities you support and work with? And what existing mental health needs has the pandemic exacerbated or created?
Yeah, I mean, I could say for our Kiva Centers community, we've lost a few people throughout the pandemic, so that's been hard, particularly related to COVID. And we had lost people prior to that as well. So I think there's been a lot of grieving around collective trauma, collective emotional distress that we've experienced. And I'd say that, you know, kind of talking about being proud of the work, that having honest conversations around that and having great responses to a lot of that grief and just sitting with people has been a highlight of my work. And even though, you know, as someone who's in a director role that's not always with folks, when I am with folks, I always feel like that's the highlight of, you know, being there and connecting with people. I also think the spaces and how we've adapted, you know, being able to hold community connections in person has been very important. So in either of our community centers, whether that be in Worcester, Framingham, or Southbridge, where we've had, you know, community members who have been able to come in, get what they need, whether that's a food delivery or technology or some support or just a place to charge their phone and have water. I think a lot of unhoused people have been disproportionately like affected by this pandemic, and that's been so important to us to have that support available. We've also opened a peer respite throughout this time. We've supported over 256 people throughout that time through both mobile peer support and on-site throughout the state. So that's been another highlight, and something that we're very happy about is the fact that we're able to support people from getting out of, you know, carceral facilities and psychiatric institutions and these spaces that can be inherently harmful for a lot of folks.
I would really just like to add on, especially about the folks at hospital settings right now. I think one thing that is often hidden from the general public's view is what's happening in hospitals right now. And COVID-19 has been used as really, I feel personally, an excuse to keep people not only longer in a closed facility, but also a lot of things like being able to go out into the community on passes, which is something that our community was previously allowed to do, has been restricted in the name of COVID precautions, right? So while staff can come in and, you know, the day before have gone to a podium or a gym unmasked, people in the community who are incarcerated at hospitals aren't able to even go on a day pass to a place like Kiva sometimes because of that restriction in the name of COVID-19 safety. So I think that's something that at Kiva we really want to highlight, is that these issues, COVID-19 is a form of collective trauma, but that trauma is being felt very differently in different populations. And I think the only other part that I just kind of like to just touch on is, I think for some in the community, COVID-19 has actually been validating, because so many people who had been very judgmental about mental health issues were suddenly experiencing mental health kind of distress and emotional distress and trauma themselves. And so people who had previously had experiences where they were labeled as kind of the problem or this is your symptoms, felt like, well, finally there are people here who now you understand that I was actually responding to the things in my life that were traumatic. And so I think in that way, COVID-19 also provided a little bit of validity to some members of our community.
Yeah, I mean, I want to echo some of what's been said. I just don't think we can underestimate the impact of isolation on human beings. nor should we overestimate technology's ability to compensate for that. I know so many people have become Zoom experts, but Zoom requires us to see ourselves on camera way more than we're used to seeing ourselves at all, which I think has been really anxiety provoking for a lot of us. It often leaves us feeling stared at by the other people in the Zoom room rather than sitting together in a circle or speaking into a void when faced with a bunch of black boxes and cameras off. And we've lost all the connection time that happens before, after, during breaks at meetings and trainings, and it's just not the same. And until this happened, I hadn't realized that there were actually over 3,000 studies out there already in existence examining the impact of quarantine on human beings. And I'm not going to argue that such measures were unnecessary, but our system did a terrible job of even acknowledging the potential impacts of that intervention on so many people. Research had already shown us that this sort of isolation was likely to lead to increases in despair, suicide, problems with substances, and more. And that's exactly what I've seen in my corner in Western Massachusetts. And frankly, my corner at this point includes a lot of different places, and I'm seeing that pretty consistently. And of course, it wasn't just because of the isolation, it was isolation in the face of constant threat and a requirement to remain vigilant. And it continues, as people have already said, to be this collective trauma we're all experiencing. And I'm also aware that research now is saying that rates didn't go up around suicide. And I just, during the pandemic, but as I look around my community, which has experienced more death and loss in the last year and a half than in any other period I can recall, and actually not predominantly due to people themselves being sick with COVID, I wonder who some of these studies are even paying attention to. We already know that many systems failed to pay attention to unhoused and other marginalized communities who had no safe space to quarantine in, with these slogans like everyone stay home together. And I'm just wondering, if they are any less invisible when talking about outcomes and impacts now. So I, like others have said, I feel most proud that we did pivot and pay attention to those communities of people that are unhoused, to sex workers, to people in domestic violence situations, to people who really didn't have places to go and ways to connect, while also putting things online for people, in some instances, who had never had access because they were in a psychiatric facility that was removed from where we could get to, or are disabled and unable to get to different places. So yeah, I do feel good about all that, but I think, we just have to keep paying attention to how long this impact is going to go.
All right, I wrote down a lot of what I want to say. I just want to be transparent that will be kind of like reading, because I don't know, it's hard for me to communicate on Zoom or like access my thoughts sometimes. So, but I think this society has responded to the pandemic in ways that have been harmful to many communities. I've noticed that people whose lives are devalued by this society have continued to not get their basic needs met. And I believe that when people don't get their needs met, they experience emotional pain and distress. When the pandemic began and things first started to shut down, I saw the loss of a lot of like public resources and public spaces. And like for people who didn't have adequate housing when the shutdown happened, that meant losing access to a bathroom in some cases. Or for people who were living in abusive situations, that meant like losing options or ways to create change in their lives or get out of unlivable situations. So I think those are examples of things that situations that cause people significant emotional distress and pain. And I think those are examples of things that lead people to consider suicide as an option when their lives feel unlivable and their needs are going unmet. Yes, that's just a bit of what I wanted to add. And I also appreciate what others have shared, appreciate this conversation.
Thank you.
And I'll try not to just reiterate all the great things that everybody else has already said, but really what I wanted to say was a lot of what has been said. And, you know, again, the initial and largest impact that I've noticed has been that loss of structure, that loss of daily life, that, you know, all of the things that we've done to keep ourselves well, were all of a sudden taken, right? They were, or changed in some really drastic way. So I'm very happy that I was able to keep my job and continuously work through this entire time, and continuously meet with, or in some way meet with the folks that I work with. In my program, we immediately started making phone calls all the time, every day. That's pretty much all we were able to do. But we did also deliver groceries and, you know, in some cases medications or whatever, you know, whatever needs we could assist with. But even now, after all this time and all this change and growth that's happened, there's still a lot of things that, you know, again, structures, day programs or groups or meetings or things that people utilized that have not come back, that were not, you know, could not continue. But I think just being able to offer some level of sort of continuity through this whole time in the relationships that you know that I've had, it's been really, really uplifting. And I also, you know, Shulamith, you mentioned you know, this sort of exposure to mental health in general because of this pandemic. And I think, and I'm happy for it, but I've definitely seen that generally speaking, self-care has become more of a ubiquitous idea, right? That people who never talked about self-care or considered it probably in any real way, all of a sudden started talking about it and started taking it seriously and understanding its real value. And the same thing, you know, with the mental health side, or like somebody else mentioned too, the isolation and disconnection. And, you know, we've all felt it. And I had quite a period during, you know, my work time that it was really hard to stay focused at all, even though I was working and connected to my team and my program. It got real blurry for a while and difficult to stay on sort of any kind of path, you know, professionally or personally. And again, the people that I work with, the individuals I meet with and spend time with and talk with, have been just absolutely outstanding throughout this entire time. It's been really beautiful to witness.
Thank you. So there were some questions. Thank you to our panelists for, I appreciate your commitment to checking in with folks. So we have a couple of questions in the Q&A. So we have, what can people who are deaf like me can do to get in-person peer support, since we deaf people depend on lip reading and cannot do so due to the face mask mandates covering people's lips? I cannot go to my local clubhouse or other in-person social events due to the face mask mandate. So I will say we had hoped to have ASL interpreting for this event, and that we weren't able to make that happen, but we do have captions. And I'm wondering if any of our panelists have anything to offer in terms of things that you're aware of or things that your programs are able to offer.
Yeah, I mean, I had wanted to respond, but not because I have like a great response. Like, I think it's an area that there's so many access areas. I mean, sort of some of the access areas have been kind of turned on their head. There's increased access because so much is happening on Zoom for some folks, and decreased access because just of the reason being described of, you know, people didn't even think through when they put together the masks that, hey, this is going to impact people who are deaf or hard of hearing. And so I know that there's been an effort to use more online resources for ASL, but in person, I'm curious what others have to say. Like, I know that there are masks that allow for lip reading that we need to do a much better job of getting access to. And I'm actually curious to hear, I haven't heard from people from the deaf community, like how effective some of those even are. I don't want to make the assumption that, sometimes these well-intended access supports are actually cutting it. And unfortunately, I would go to the folks who are based in Central Mass for the Worcester State Hospital question, because that is not one I am particularly well informed in.
I can kind of add on to a little bit of that. I know that Kiva did apply for funding actually to train a all deaf and hard of hearing certified peer specialist class, and we sent in the funding, or the grant, the RFO for that, and we just never heard back after months of waiting. So I think there's also been frustration kind of on the ground where we're hearing, these accessibility concerns, like trying to respond to community needs. And I felt like kind of on higher levels, whether that is kind of confusion around, vaccine information that's accurate, to getting funding, to mask wearing, and the kind of rhetoric around social distancing. There's been, I think, a failure on multiple levels in terms of higher up how I think our government has handled many of these issues. I do know for Worcester Recovery Center and Hospital, Worcester State Hospital, in particular, the deaf unit does have the masks that are clear. I don't know how often there are interpreter services available in that unit, but that is something I can absolutely look into, and have the context to look into that. And I also think, Sarah, your question about how effective, I'm not quite sure how effective they are with being able to lip read, but I do know that they were proven to be less effective in keeping people safe from COVID. So this, again, like, we have these accessibility needs, and it feels like we're not producing products or things that are accessible in both ways, health-wise and for the ability to actually read lips.
Thank you. So I'd like to go to Vesper, but first I just want to clarify for folks tuning in. So the additional question was, does anyone know what the Worcester Recovery Center deaf unit is doing to help with communication, since I am deaf but don't use ASL but depend on lip reading? I'm getting more symptomatic and my treatment team wants me to go to the hospital, but I don't want to go into a regular psych hospital due to my inability to communicate with anyone because of the face masks being used by hospital staff and other patients. So I just wanted to make sure we all had the wording for that question to think about. Vesper, if you could go next.
I mean, I also wanted to kind of just preface aloud and say that are you looking to go to a hospital, Lee? I mean, if possible, I mean, there's also peer respites, as we were describing earlier, that are options like Karaya or Afiya, and I could say that although none of our staff at this time are deaf and hard of hearing themselves, we could have interpreters, and we've done that work to have easy access to interpreters within a 24-hour time frame. That's a commitment to accessibility for us, is that we know where to access them, when to, and how quickly we can have that turnaround. In terms of supports in the community, we've had deaf to deaf peer support. We have someone in the community who would facilitate deaf to deaf peer support groups, named Min Vo. Min currently isn't facilitating those support groups. We are looking for more deaf facilitators, and making these trainings accessible is important. And yeah, I mean, I just want to offer peer respite as an alternative to going to a state hospital. So.
Michael, I don't know if you have anything for that question. If not, I think we can
Not really. I don't really have, or I haven't had any experience with that.
Okay, so we do have a question at the end about some resources. And MassSupport will be sharing resources through our social media, through Facebook, Twitter, Instagram. We're also on LinkedIn and YouTube. So the next question is, are there any mental health impacts on the community that have been surprising or unexpected for you? And that's a little bit more of maybe the same that we've been talking about, but I wonder if we could look at that.
Are you wanting us to go in the same order?
If that's all right with folks, the same order. Yeah, what is it? Safety, predictability, and control.
So the question's on safety, predictability, and control. I'm sorry.
No, sorry. So no, the question is not on safety, predictability, and control. It's just, sorry, we say that a lot at MassSupport when we're trying to be mindful of having folks know what to expect from us. And so, yeah, if we could go around in the same order each time. Thank you for clarifying.
No, of course. So I mean, in terms of the question, what is the question we're focusing on right now?
Oh, yes, sorry. So the question is, are there any mental health impacts on the community that have been surprising or unexpected to you?
So I think I wouldn't necessarily say surprising, because I think, you know, when you have a community spaces that are open to anyone, and, you know, regardless of what state of emotional distress they may be experiencing, that it's, you know, I wouldn't necessarily call it surprising, but I have seen a lot of responses, particularly, and there are responses that make perfect sense, particularly to things like vaccination. So, for example, a lot of people in our BIPOC communities are really speaking to that they don't trust vaccinations due to the fact that historically government and private industry have, you know, tested chemicals on the bodies of BIPOC people, and that there's also the concern of blood clots as a result of receiving vaccination. There's also the concern of, you know, also being able to go outside amongst people who may have, you know, COVID-19, while simultaneously not wanting to be vaccinated. So that's, in a way, something that I've never really anticipated, being in a circumstance where people are fearful of being in the community for one reason or another, but yet the treatment options are not, they just don't, they just aren't an option, either because of trauma or because of what the person's experiencing. And then there's a lot of, I've seen a lot of people overlook disabled folks. It's been a really ableist 2 years. I think, you know, people saying, I'm tired of wearing this mask, I'm going to take it off, or I'm going to do this, and simultaneously immunocompromised and disabled folks fearing for their lives and being like, no one actually cares whether if I live or die. So that's been something else that I've seen that's been distressing. Again, I don't think it's surprising, right? But it's more like, it's not something that you always anticipate, because I don't think that we've been in a circumstance like this before.
Yeah, I would echo a lot of what Vesper said. No surprises, but I think one change that I have noted is that not all, but there are, I think, some people in the community are tired of the word resiliency. I think that's definitely a change. I think this concept of resiliency has almost been used to silence real concerns of like, we'll just be resilient. You're going to get through this, right? And I think while resiliency is a skill, I think there's been a sense of this pandemic has lasted for way too long. And I think that is draining. I think that is traumatic. I think it's traumatic from many levels. And I think when we talk about trauma, I'm talking, as Vesper said, you know, the trauma of people who are, you know, in nursing facilities, who are disabled, who feel that their life doesn't matter to other people. I'm also talking about the trauma of other folks in the community who've had family members and people that they've loved died from the opioid epidemic, which was mishandled by the same people who now are being told who created the vaccine, right? And so I think these roots of trauma that were never validated before, still haven't been validated on the level that I think there needs to be. I think as an organization, I think Kiva Centers has a duty to be a source of trustworthy information, because I think that's also, people don't know who to trust. And I think earning that trust is something that's been overlooked by, I think, a lot of people, especially higher up in our government, who have campaigns for vaccination that really don't address the underlying issues.
So I guess, like others, I'm going to start by saying, I wouldn't exactly say I'm surprised by this, but it hadn't immediately occurred to me what a good teacher COVID-19 would be about the impacts of psychiatric oppression. Psychiatric oppression is the marginalization and systemic oppression of people with psychiatric histories. And in fact, I actually wrote an article on Mad in America about what COVID-19 has to teach us about this form of oppression. We actually did some brief research in our own community on how past histories with experiences of force in the psychiatric system impacted whether or not someone also whether or not someone would actually experience an increase in suicidal thoughts during the pandemic. And what we found was really interesting. I won't get into all the details, but what we found in this small study was that only around 25% of people who participated in it, who had never been locked on a psychiatric unit or experienced psychiatric force, experienced an increase in suicidal thoughts during the pandemic, but nearly 60% of people who said they'd experienced force in the psychiatric system reported an increase in suicidal thoughts while quarantined. And I think that's really telling. I would suggest this is related to the extreme loss of power and control that many people experience when put in these psychiatric facilities and also when quarantined. And I do actually want to read just two quick quotes that I included in that article I mentioned that get at maybe some piece of this, because I certainly don't want to equate quarantines with being in psychiatric hospital, but there is this compounding way that these losses of power and control impact, and some relationship that some people have experienced between those two things. So this first quote: "The space inside my apartment is starting to feel as heavy and dense as the space within a locked unit. Each time while locked up, it felt almost like being underwater and being unable to breathe. Dense and stifling and solid and horribly grave. I can't bear having the space within my own home having this density and this gravity." So that was Kaz DeWolf. And then, so this is not the same as solitary confinement or an isolation room. I can feel the sun. I can walk more than 5 feet before having to turn around. I can see signs of life and hear cars go by. I have entertainment and kitchen privileges. And this social distancing still reminds me of being locked away. And that was Cindy Hadge, who I work with. So just think there's a lot for us to unpack with all of this.
Yeah, I guess I also, in response to this question, on some level haven't been surprised by what I have seen and witnessed, but I guess, but I've still been shocked. I've still been shocked on some level, and I have been surprised by just kind of the lack of acknowledgement of, like, collectively by the society of like what a traumatic event this has been for so many people, and just, yeah, the lack of acknowledgement, the lack of supports for people to grieve, and so I guess I expect to be surprised in the coming years by all the ways that like the unmetabolized trauma from this crisis, how it shows up in people's lives. I think that'll be surprising and unexpected, and something that I'll witness in my life and other people's lives in the coming years. Yeah.
So I want to share just two things that really stuck out to me in response to this question, one positive and one negative. And initially when this happened, I, like everybody, was incredibly fearful of what we were facing and what this meant. And I was really, I struggled myself with being overtaken by the idea that everything was about to fall apart and just not knowing. And it, you know, after that first few months and when things sort of, you know, I was able to see that, you know, I was still able to, we were still able to, you know, go to work and mostly, and do the things, you know, get groceries and that kind of thing. But once we got to that point, I really saw that the people that I work with, and the people that utilize the program I work for, really did quite well in adapting to this new kind of way of living life, with all of its challenges and barriers and pitfalls and difficulties. People really kind of utilized what was available to them, leaned on the people that were close to them and the people that they had in their lives, and were really able to, again, adapt to the circumstances that we found ourselves in. I guess I consider myself a positive person and an optimist, but I really was afraid that people were gonna have a much harder time. Again, the people that I work with directly, especially, I thought people were gonna really struggle, and I was very happy to see that, you know, of course we all struggled, but that people were able to take care of each other. It was a very nice surprise. The other side of that, and Shulamith, again, you mentioned earlier that the thing that really stands out to me the most isn't necessarily the number of hospitalizations I've seen in folks, the number of people that have gone to use inpatient services, but it's the duration of those stays. I've been doing this for 3 years, and I've met with a lot of people, and I'm exposed to a lot of people that use services, and it really stuck out like dramatically. I mean, I'm talking, there are a few people that have been in the hospital for a year, like that. I've just never seen it in pre-pandemic, and I don't understand it. And there's a lot of folks that I've maintained my relationship with during that time, so I've been able to stay connected with them, and it just doesn't make sense to me. I don't understand why that is a thing. It doesn't make any sense to me, and yeah, so that's been probably the biggest question mark and surprise for me, was seeing that. Go ahead, Vesper. Or Andrew.
Yeah, I just wanted to add, I mean, I think that something that's been very important of note, recently I was supporting someone who went in for a medical reason to a hospital and then was kept involuntarily because they hadn't slept for like 3 days and they weren't doing well. And they didn't think about the environmental factors. And then they were told that they could keep them longer because of a recent case. I think it was with Mass General Hospital or something, where they could decide to hold someone involuntary. And anyway, it was a lie. They were lied to. And we found out that it was a lie, and advocated for days and days and days to get them out. This is a person with a pacemaker, and the pacemaker was hurting them and it kept them up. and I was trying to get a hold of them, and hospitals can't confirm or deny if someone's there. So it took some time, but we were able to get them out. But there is this circumstance right now, and I've been doing a lot of this work both in the state and on the federal floor, challenging hospital licensure boards to really talk about the circumstance and a lot of the things that have been used. I mean, right here in the state of Massachusetts, at a facility like the JRC, for example, where electroshock devices are being used on young adults, and other forms to correct behavior, to do all of these things. The amount of people who are held on units and have not been informed, throughout the time, it's terrible. So the level of psychiatric oppression that has been happening is terrible. And I also think that there's been a lot of note for the psychiatric survivor movement, MAD movement, when we've been talking about peer support and alternatives as well as psychiatric abolition, due to the fact that at this time, I think people are starting to realize how awful, and I don't think they quite realize fully yet, carceral facilities are. All forms of carceral facilities. And the fact that in the community, the fact that we're told these certain ideas around that we have to go to these providers for help is actually, an aspect of, and more metaphorically, but also literally being incarcerated, like our minds being incarcerated in the community, that we can only turn to these sources. So we can't actually turn to each other. We can't focus on the collective. It's this damaging idea of individualism that we're sold.
Yeah, I would just really like to add on to what Vesper was saying, is the system, especially where the folks that I'm supporting, in an actual double bind, where on one hand, they're told that in order to get out of the hospital, they have to go on these independent passes in the community, right? And that's laid out by what's called an independent forensic risk assessment, which is done through one system, the district attorney, right? Then the hospital has a policy because of the Department of Public Health, which says that no one is allowed to leave the hospital on these independent passes. So you have people who are, their ability to actually work towards being in the community has been denied to them because the system says two contradictory things that then they have to navigate. And I just really want to focus, just focus on the depth of that trauma right there. When these places are called, and Sera pointed this out in the chat, recovery centers, but they're not human-centered in the fact that, a place of human centers is a place where you can see your friends, you can have pets, you can, go outside. That's another thing, is when we talk about COVID, because of the restrictions in the hospital right now, people really only have about 30 minutes a day outside at the Worcester State Hospital right now. When we talk about evidence-based practices, why isn't it evidence when someone is screaming and crying in pain, or someone is very articulately and poignantly saying, this is not helping me. In fact, this is hurting me. Why isn't that evidence? I think so much of these conversations, unfortunately, are behind closed doors. And I think it's really, really important that we talk about it, because I'm actually disturbed by how much COVID-19 has increased the use of psychiatric force, increased the sense of people are in distress, and the only option that people know that is available to them are these mental health professionals who you might end up stuck in a hospital, and your needs aren't going to get met at the end of the day. I know Vesper mentioned one person in the community who was put in the hospital because of their pacemaker issues, which was then labeled as a psychiatric issue. So the health needs weren't met. Then they lost, a job training opportunity in their housing. So how is that in their best interest to lose their housing, job opportunity, financial, and social connections all in one suit because someone else decided that was best for them? What was so infuriating about that case in particular was I was supporting someone else same week who wanted to go inpatient for their own reasons, right? Was begging to go, and the hospital said there wasn't enough beds. And so the fact that there were two different people that we were supporting simultaneously whose neither of their needs were met. Like I feel that something is really amiss there.
Thank you. I do want to, I want to give Sera a chance to add what you want to add, Sera, but I also want to note that we're at 5 minutes to 2, and in the interest of that safety, predictability, and control, folks knowing what to expect from us, I do want to still wrap up on time for folks, both in terms of our panelists' commitment of time. So Sera, if you could.
Yeah, I just, I think part of what we're landing in here, part of where this conversation has gone, even though it's not expected, it wasn't quite planned this way, is that the Department of Mental Health and many of the services are talked about as places to go for help, but they actually have dual purposes. There is a piece in there to help, but then there's also this piece that isn't as often talked about to protect society. And that increases the desire to control people. And if you talk to someone at the Department of Mental Health who's in an honest moment, they will say, yes, we are split between these two purposes. And so if you then look at some of the state paperwork in the hospitals to get out, they've added questions like, is this person properly socially distancing? Is this person wearing masks? Those sorts of things. And completely discriminatory, but it's there. They say that it's not being used to withhold people's release, but I am pretty skeptical of that. And I do think that there is an issue here where people are being deemed not able to protect themselves and others when out in society when it comes to COVID, and therefore we're going to hold them here longer. The reality is the state also withheld statistics on how many people in these hospitals were COVID positive for many months, and I was a part of a real effort. And I think this is a role of peer support, is to be an agitator, to get in there, advocate, be a change agent, and be a voice to constantly push. We had to push, and we had to get the backing of all these disability lawyer advocacy organizations to be present in meetings with us in the Department of Mental Health, even to get them to release the statistics on how many people were COVID positive in those facilities. So I was at those meetings and it was rough. And we found out things like, oh, in the one in Western Mass, 90% positivity rate for people in that being held in that facility. So I think there's something real to dig into here about the state's divided interests and how we're supporting people and how discrimination plays out. I also think this is a time, and this gets to another question that got missed because of time, that we need to raise rates of how people in these roles are being supported. And that was one of the things I'd wanted to say later. We are now seeing many other industries recognize how low the rates are. Like, fast food, you can now easily get paid more to work in the fast food industry than you can in peer support. So I just want to put in a pitch for that absolutely needing to change, because the intensity of our work and the importance of our work is really immense.
Thank you. So we did have a few more questions. We're not going to get through them, but I do want to include, I think I'd like to focus, folks can either talk a little bit about resources that you would recommend for folks, whether that's to folks themselves or to folks, to other peer specialists working, doing this work, or to other folks working in mental health. We know that a lot of times more traditional roles are sort of de facto gatekeepers of newer models of support. So what other resources would you recommend for those folks?
Yeah, I mean, a lot of a resource that we've been supporting a lot of communities in building and that we've built a lot of have been community fridges. Just particularly around food, I want to start that, 24-hour, 7 days a week access to food has been really important. Something that's not policed, but just governed by the community, right? And working together. Kiva centers, we sponsor, I think 6, 7 community fridges, and we stock them every week, along with about I want to say maybe like a couple hundred food deliveries a week. Food has been a really, big thing. I mean, like people want to sit down and, like do whether it be one-to-one peer support or group peer support, and the person's like, well, I'm starving and I can't actually talk to you right now. And that's a very real thing. Like, how do we address a lot of those things first? There have also been a lot of shelters that have been opening up in hotels and in other spaces. We opened our peer respite in a hotel, and now we're opening up in a house because we're in, it's going to be a permanent model. So and those resources have kind of sprung up throughout COVID. I can't necessarily name like one website. That there's a huge Massachusetts housing directory that just opened. I want to say it's probably on mass.gov. I can't remember the exact link right now, but I'd be willing to share that to be shared widely. Or if anyone's interested, they can email me at vmore@kivacenters.org.
Thank you.
I think as Vesper mentioned, food was a big thing. I was very excited to see that Worcester and a few other surrounding kind of towns and cities had the refrigerators, the community refrigerator project, so that people can access that anywhere. I have heard lately that the refrigerators haven't been stocked as full, so just kind of a reminder to the folks out there, if you have extras, feel free to stock those refrigerators. I think those mutual aid projects and mutual aid networks in general have been so valuable to a community. Things that are overlooked, like, you might have a place to stay, but that place is infested with bed bugs and your landlord isn't going to do anything about it, right? Having a mutual network where you can stay with a friend, that I think those outer systems networks, I think, have been the things that I have relied on, and I know the community has relied on more because they've come through more often.
So I do want to be mindful of the time, but I also want to give everyone an opportunity to answer this. So we're going to continue Sera and then Riley and then Michael, and then we'll wrap up.
Yeah, I think that obviously the housing, food, anything that's basic needs is going to be absolutely top priority. I don't have much to offer to what's already been shared because there's not enough. Like, there's not enough. We need to be a much stronger voice pushing for more of these resources. There's really not a good reason that there isn't more. But I do think just being aware of some of the peer support lines out there where you can call and hopefully get some of these information. A good peer support line will be able to help people connect with basic needs kinds of support. So even just going to warmline.org, which Howard Trackman and others have had a role in organizing, and seeing where peer support lines are in your area can be a really useful resource. Just bear in mind that that website at this time does not tell you which of those lines connect you to crisis lines or have a police potential oriented response that could show up at your house. So if suicide is your conversation, I would do some research before you are too open with some of those lines. I will say the Wildflower Alliance line will not do that, but I can't speak for the others at this time. I would also say, just if people want to go to our website, wildfloweralliance.org, we do have links to other resources in there, as well as a lot of online groups. And we started a Discord server at the start of this whole pandemic. That is another place to connect and hopefully connect about some of these resources, because there's no way we could list off everything's available. But the whole principle of our community is we share what we learn with each other. And so things like the Discord server and these online groups are a great place to do that.
Thank you.
I don't really have anything to add that hasn't already been said.
Thank you.
I also don't have a ton of resources to add, but I do want to say that, for me in my work, this may be kind of odd, but the Kiva Center and the Kiva Centers are a huge resource and an amazing opportunity for people to get connected to each other and to support each other. And it's just, I can't advocate enough for more of that, as well as the peer respites. A lot of the folks that I work with have already used Karaya because it's pretty close to our area. It's just, we need way more of it. Also, the housing piece is, it's just devastating in Massachusetts right now. And we just need a lot more effort in that area. But the other thing too is something that I've gotten a little bit more involved in lately is the Dual Recovery Anonymous meetings that have been taking place and sort of growing, and also the Clubhouse model. You know, I've used all of these in my own recovery in my own life, and I know they're not everything is for everybody. Some people fit better with different, you know, models. So, but that's why we need all of them, because you never know what's going to get you.
I'd like to thank everybody for participating and staying on a little bit longer. I know we started a little bit late, and I appreciate everybody joining us and being part of this conversation. And I appreciate all of our attendees who've joined, who've tuned in, whether through Zoom or Facebook Live, or folks who are a few weeks from now watching this on YouTube. So I just want to thank everyone from MassSupport. And we will be sharing some resources in the coming days, in the coming weeks, from this roundtable on our social media platforms to sort of help folks connect the dots. So thank you.
Thank you. It's been a pleasure.
Thank you.
Hi, everybody.